Hi, I'm Dr. Minerva Santos, and welcome to Your Health Today, the medical show that tries to keep you informed about what's happening today. My guest today is Peter Gottesfeld, who every year, without fail, for how many years is it? Have you been the best doctor in Westchester?
It's too many to count.
It's too many to count. I mean, I stopped counting, probably starting about 2000 maybe?
Yeah.
For the last 10 years, has been chosen as one of Westchester's best docs. And he is. So welcome,
thank
Peter.
you. Thank you very much. Good to be here.
So what are we going to talk about today? You're going to start to be a regular guest.
Okay. Well, my big interest lately has been taking family practice, which I love. You know, family practice, we do general medicine, but we're taught to look at the entire individual. Not really the whole patient, but the whole individual. Because we realize that people function in the setting of their job, their family, where they live. So we look at all these different factors and how they have an impact on the patient's health. And the first goal, of course, is to help patients maintain health and avoid illness. And the second part of that is when patients do have illness, to return them to health as quickly as possible. So working from that beginning, we've all learned in our position that it's hard to help patients to achieve their goals. It's hard for people to lose weight. It's hard for people to maintain muscle strength. As people get older, they become more frail. As people get older, there's more illness. So in looking for a way to help maintain and improve health, through research and conferences, I became interested in age management. And my own particular training in this field was done through a practice based in Las Vegas called Cenegenics, which developed their own style over the past 13 years. At first as a member of the Anti-Aging Society, and then realizing that their approach isn't anti-aging, but healthy aging.
Right.
That there's actually
we're
good
still going to get old.
And that's something to be desired. There's a lot of experience that comes with aging. There's a lot of knowledge that aging is a good thing, but the goal is to be healthy as we age rather than to develop illness. So with the perspective of age management, they have really developed protocols involving nutrition, optimizing nutrition for both loss of body fat and also maintenance of muscle mass, nutrition for optimizing cholesterol, optimizing sugar metabolism, and exercise. Exercise has so many benefits, and there really is a significant amount of data showing what kind of exercise is most beneficial. We also know that the kinds of exercise that are beneficial change as we get older. Most people are surprised to learn that at younger ages, cardio is more beneficial or more important than resistance exercise, but at age of 60, that changes, and in fact, resistance exercise, weightlifting for both men and women, becomes more important than cardio.
Would that be because it helps maintain your muscle mass and also build bone strength?
It helps maintain and build bone strength, muscle mass. There are studies showing that muscle strength correlates inversely with mortality. That is, people with better strength have lower mortality rates. Helps with balance and coordination, avoiding falls, avoiding fractures.
Issue.
Data showing that exercise is beneficial for maintenance of cognitive ability. So we know how to tweak exercise to really get the most of all these different benefits. So it's actually taking common wisdom and actually taking it to a scientific level. So there's nutrition, there's exercise, and there are supplements, nutraceutical supplements, which have been shown in studies to be beneficial.
Right. Now, what are nutraceuticals?
Nutraceuticals are supplements, sometimes vitamins, sometimes herbal preparations. which can be anti-inflammatory, which can maintain connective tissue health, bone health, cognitive health, depending on what issues a patient is having.
Let me ask you, you mentioned
we could use those.
inflammation.
Yes.
You know, I'm doing that 2-year fellowship with Dr. Weil.
Sure.
And his whole premise on aging is that all disease and all deterioration of the body that goes along with aging has an inflammatory component to it. What's your take on that?
That's the current thinking, is to reduce inflammation in order to help prevent disease. But I think that, as with most things in life, it's multifactorial.
Right.
So inflammation is one part of it. We also have to make sure that metabolism functions properly to maintain cell health. We know that all processes in the body exist in a balance of breakdown and growth. In fact, without some breakdown, you can't really have growth. As we get older, the balance shifts, where when we're younger and growing, growth outstrips breakdown, but when we're older,
right.
breakdown and deterioration outstrips growth. And in fact, that leads to the fourth pillar of the Cenogenics practice. But you say, well, why does that happen? And the fourth pillar really is what happens to us hormonally.
Right.
It's hormones in our body which direct all the individual cells what processes to engage in. In order to build protein, we have to have the right enzymes present in the cells to do that. You need to have the right food so the enzymes can use that. You need to have the right exercise to stimulate the growth. But without the proper enzymes, none of that's going to happen. So how does the cell know, oh, I've got to make more of this enzyme? Well, all of that is really directed by our hormones. And we now live in a different situation than we did when we were cavemen. Right? When we were cavemen, you had your kids when you were 20, and by the time they were 15, they didn't need you around anymore. You were a useless mouth. But now in today's society, there's a real benefit to grandparents and great-grandparents. We can actually contribute to the well-being of our children and grandchildren and great-grandchildren. So circumstances have really changed, whereas we evolved at a time when we didn't need to live to be 50.
Right. And I think also all us baby boomers, we're not ready to go, and we're not going to grow old gracefully. We want to continue to feel viable and feel well.
Well, to be old and not viable and well is not graceful.
No.
Right? No. Aging gracefully doesn't mean accepting disability and becoming decrepit. That's not good. That's not good for anyone. There is actually some, I believe, objective good. Right? As physicians, I think we buy that objectively, health is a good thing. Now, there are, philosophically, there are things that we can't cure. So caring for people is a good thing. Maximizing independence, maximizing well-being is a good thing. Minimizing pain is a good thing. Minimizing suffering is a good thing. So all of that, of course, is part of medicine. But if we can prevent disability, that's what's graceful. To be 80 years old and climbing mountains.
Sure.
That's graceful.
That's where that whole thing started with finding, I can't really remember what island in Greece it was, where that's what started the whole Mediterranean diet, because they're in their 90s and 100s and they're fishing and climbing mountains and they're up from the crack of dawn till the evening, and they're behaving like our perception of a 40-year-old. And these are elderly people who live for a long time.
Right.
And so the question was, well, why is that?
Nutrition, exercise, and then hormones. And it's very interesting because for some reason, which I still don't understand, medicine has come such a long way. But when it comes to the idea of recognizing one of the basic processes that leads to deterioration and saying, okay, we can actually keep this from happening, the general medical community actually looks at it as a bad thing.
Oh, yeah.
And society in general looks at it as a bad thing, and I really don't understand why.
I think things are changing. I think basically the medical community, we were trained to treat disease entities. We were not trained to prevent or even look at how can I keep this person healthy. Our training has basically been how can I prolong their life once they have something. And for those of us like you and myself who do a lot of preventative medicine, I think that's what has shifted us in a different direction than the regular medical community, and that we're really focusing on how can I keep my patients healthy? How can I make their lives worthwhile, rather than focusing on, okay, now you have this disease, let's deal with it, which we do, but our goal is not to have them be there, which you're right. It's an issue that, I go to all these conferences like you do on, and mine is more alternative medicine and integrative medicine, and a lot of it has to do with health and nutrition. And I actually went in Atlanta, they had in May this big health and nutrition conference, and it was amazing the things that nutrition and diet can do for the human body. But we never learned that. What did we ever learn about in nutrition in medical school? Nothing.
Right.
Not
because if you can't put it in a pill, if you can't put it in a pill and write a prescription and tell a patient, take this, and then measure, did he take it or not?
Right.
Did she comply or not? And we can go to conferences and read papers about patient compliance, about whether or not they're following instructions. But hormone optimization, we can put that in pill form, and they still don't think it's right, and they still don't think it's good. But
yet, if you tell a patient, you know what, if you tweak your diet a little bit this way and this, it'll be better. I find it easier and patients to be more compliant when they have a certain amount of control and that they realize, you know what, this tomato has stuff that's going to help.
Right.
And people can do that because it's part of it that, like you said, they have to be a partner.
Sure.
And it's not so much like, okay, here, take this pill, it's going to help with your cholesterol. Whereas I can say, okay, you can follow this Mediterranean diet. Won't bring your cholesterol down, but it will decrease your risk of a heart attack.
That's right.
And people, I can do that. I can tweak my diet.
We can teach people, and when people have information, they can make choices for themselves. And the choice that someone makes for themselves, by definition, they're making it for themselves, it's the right choice for them.
Right.
It's a good thing. But we can certainly give people the information they need so that they can do what they are able to do to really optimize their health. So the things we're talking about are not for everyone, but when we know that we have something that can really benefit from someone and really does them good and doesn't do them harm, how can we not offer it to them?
Right.
How can we not put it out there and say, this is available? And yes, if this is the road you want to take, then we can help you do that. So in a way, the medical community is not living up to its oath.
Right.
To help people. If we say that we know that this can help, but we're not going to offer it, or we're going to actually put up barriers. I think when you think, well, why was it then that hormone optimization fell out of favor? Because remember when we were in training, actually I love telling patients this story because it's so interesting how things change, but the character of the medical community hasn't changed that much. When we were in training, all women, when they approached the menopause, were put on estrogen and progesterone. If they had had a hysterectomy, we wouldn't use progesterone, they would just be on estrogen. And everyone did it. And if they didn't want it, their doctors would pat them on the hand and say, there, this is good for you.
Right.
Right? So it was a very sort of,
it
was a very parental sort of approach. And because most doctors were men then, and it was it was with their women patients, not with the men, it was a very kind of paternal approach. And then what happened, though, is we knew that we were doing that in order to prevent osteoporosis, and that was the big benefit. We were going to delay the onset of osteoporosis and prevent fractures, which is a huge issue. I don't know if viewers realize that the mortality rate after a hip fracture is 30% in the first year. I mean, it's huge. It's not just the hip fracture, it's what happens afterwards. But then we all thought, well, women don't get as much heart disease as men. So therefore, it's the estrogen.
Right.
It's got to be the estrogen.
It's protective.
So let's design a study to show how wonderful we are, how wonderful doctors can be, not just at preventing hip fractures, but hey, we're going to save women from heart attacks and stroke. So they developed the Women's Health Initiative in 1997, which had over 60,000